So this is Dr. Divya, live class educator for anatomy at Auricle. So this exam mastery live classes, we have started since June 5th, and it's a duration of about 30 days. So here we are doing rapid revision of all the important questions, as well as quick revision of volatile facts. High yielding topics of all the subjects are covered here. And most expected questions in the university exams will be covered here. So these classes are beneficial for everyone of all the university exams of all the states. You can use the code Dr. Divya 20 for the first free live class. So in today's class, we will be covering all these topics: that's facial vein, dangerous area of face, deep cervical fascia and its layers, then carotid sheath, pharyngeal spaces, lateral pharyngeal space, sternocleidomastoid muscle, and digastric triangle. So all these topics are very important topics which are very frequently asked in the exam. You can use the code Dr. Divya 20 for the discount on subscription. And we have this core features of Auricle. So here we offer you live classes as well as recorded classes. And the benefit of this is you can access them anytime, anywhere. And we also give you CBME-based question and answers notes as well as MCQs. And the MCQs are from the standard beginner level to up to expert level. And they're all standard multiple choice questions which are frequently asked in the exams. So we have 3 subscription plans here: the basic, standard, and the mentorship program. Mentorship is a wholesome program which we are giving you at a special rate of 50,000. So here, including the pre-recorded classes, live class, live doubt clarification, and quick revision examination module, we also offer you live doubt clearing, clarification as one-to-one personalized guidance, and also offer you notes. So you can use the code for the discount on subscription. And you can also as well book a slot for personalized counseling session on the app. So we'll start with today's class. So the first question is facial vein. So what do we mean? So first, always you need to write the definition. What is that? It is the facial vein is the largest vein in the face, and it has no valves. Okay. So all the head and neck veins, no, except for internal jugular vein, they do not have valves because the blood is flowing towards gravity. So that is why there are no valves. So here it begins as the angular vein at the medial angle of the eye. Okay, where it is formed by the union of, supratrochlear and supraorbital vein. So the angular vein continues as the facial vein, and the vein runs on the face downwards, backwards, and behind the facial artery. Okay, but it actually lies superficial to the facial artery. Facial artery is deeper, whereas facial vein is superficial. It crosses the anterior-inferior angle of the masseter. Okay, and it is pierces the deep fascia and crosses the submandibular gland. Okay, and then it joins the anterior division of retromandibular vein, which is below the apex of the parotid gland. Okay, so it joins the anterior division of retromandibular vein to form the common facial vein, and it drains into the internal jugular vein. So this facial vein, it has got deeper communications, that is, through the superior orbital and superior ophthalmic vein, okay, supraorbital and superior. So through this supraorbital, and it communicates with the superior ophthalmic vein, because the ones which drain there, which are there, the formative veins there. And it also connects with the pterygoid venous plexus through the deep facial vein, okay, which passes backwards. So you can see here. So this is the pterygoid venous plexus, and this is the deep facial vein here, which you can see. Next question is the dangerous area of the face. Okay, it's usually asked as a 3 marks short answer question. So which is the dangerous area of the face? It is the upper lip, the septum of the nose. So if you see here, the upper lip part, the septum, nasal septum at the adjoining area of the cheek. So basically the upper part of the lip that is in the philtrum area. This is the philtrum. So that is basically the dangerous area of the face. So the facial, why it is dangerous now? The facial vein here, which we saw earlier, it communicates with the cavernous sinus, okay, through the emissary veins. That is how it communicates is facial vein communicates, because there are no valves, there is always retrograde flow of blood. So facial vein to the deep facial vein, from the deep facial vein to the pterygoid venous plexus, and pterygoid venous plexus through the emissary vein, it's connected to the cavernous sinus. Okay, so since there are no valves, it makes way for an uninterrupted passage of blood to the cavernous sinus. So in case of any infection in that area, like, any pustules or like any trauma, especially in children, we see picking of nose and all those things. So infections will be carried, okay? So it can get infected, those wounds, those pustules. From there, the infection can be carried through this pathway to the cavernous sinus. And infection of the cavernous sinus leads to cavernous venous thrombosis, cavernous sinus thrombosis, okay? Okay, a 30-year-old man, okay, 30-year-old man comes to the OPD with inability to close his left eye, tears are overflowing on the left cheek and saliva dribbling from the left angle of the mouth. So when this is asked, so what do you think of it? It is basically the lower motor neuron type of facial palsy, okay? Now, that was done in the previous class. So here, today's class, you can see, this is the MCQ which can be asked. So the dangerous area of the face is named because of connection of the cavernous sinus with the facial vein. Through which vein? So it is through, answer is deep facial, okay? Deep facial vein. And infection in the dangerous area of the face usually leads to which this thing, sinus will be affected, cavernous sinus, okay? So it leads to cavernous sinus thrombosis. Next is deep cervical fascia or fascia coli. So the deep fascia of the neck, it's the condensed to form the layers. Okay, so the deep fascia will be condensed there, and it has a few modifications which we see it as investing layer, pretracheal fascia, then the prevertebral fascia, the carotid layer, the buccopharyngeal fascia, and the pharyngobasilar fascia. So the investing layer, it lies, so first coming to the investing layer. Now it lies deep to the platysma. So platysma is in the superficial fascia, okay? So this investing layer lies deep to the platysma and surrounds the neck like a collar. That is why it is called as the investing layer. It's all around the neck. So attachments. So attachments, we need to know the superior attachment, the inferior attachment, anterior and the posterior, okay? So superiorly, if you take from the external occipital protuberance, okay? So external occipital protuberance, and as you trace it along the superior nuchal line, from there to the mastoid process, then styloid process, external acoustic meatus, and comes to the base of the mandible, okay? Base of the mandible. Then inferiorly, it is attached to the spine of the scapula, acromion process, okay, clavicle, and in the front when it comes to the manubrium sterni, okay. Posteriorly, that is in the center, posteriorly, it is related, attached to the ligamentum nuchae, the spine of C7 vertebrae. And anteriorly, it extends from the symphysis mentae up to the hyoid bone. Okay, so that is the attachment. So here, this investing layer, no, it follows kind of rule of two. What do we mean by that is, this investing layer, it splits, okay, to enclose two muscles, that is trapezius and the sternocleidomastoid. It also splits to enclose, that is forms the false capsule for two glands, that is parotid and submandibular. And it encloses two spaces, that is suprasternal space and one other one is the supraclavicular space. Okay, so this is how the investing layer of the deep cervical fascia is. Then pretracheal fascia. Okay, short answer question it is. So here you will see pretracheal fascia. It encloses and suspends the thyroid gland and forms, okay, its false capsule. So, and it also continues with the buccopharyngeal fascia. So where it is attached, pretracheal, superiorly it is attached to the hyoid bone. Okay, the oblique line of the cricoid, the thyroid cartilage, then the cricoid cartilage, then to the hyoid bone, okay, hyoid bone and the cricoid cartilage, hyoid bone, okay, so superiorly. Inferiorly, below the thyroid gland, it encloses the inferior thyroid veins, passes behind the brachiocephalic vein, okay, And below the thyroid on either side, it forms the front of the carotid, that is the anterior layer of the carotid sheath, and fuses with the fascia deep to the sternocleidomastoid. Okay, so that is the attachment of the pretracheal fascia. So the posterior layer of the thyroid capsule is thick on either side, and it forms the, like here if you see, the posterior layer, right? It is thick on either side. It forms the suspensory ligament for the thyroid gland, which is known as the ligament of Berry. So you can see here how the superiorly attachment, thyroid oblique line of the, that is the hyoid bone, it is attached, then oblique line of the thyroid cartilage, and then cricoid cartilage it comes, and then it will be going down. Okay, so this one, inferiorly below the thyroid gland, it will enclose the inferior thyroid veins here. Then prevertebral. Prevertebral layer, it lies in front of the, as the name says, prevertebral. So in front of the vertebra. Okay, so here it lies in front of the prevertebral muscles and forms the floor of the posterior triangle of the neck. So here superiorly, this prevertebral fascia is attached to the base of the skull. Inferiorly, it extends into the superior mediastinum and splits into anterior and posterior layers. Okay, it splits. And anteriorly, it is separated from the pharynx, okay, and buccopharyngeal space. Between the buccopharyngeal fascia and the pharynx, there is a small space which is known as the retropharyngeal space. Okay, so it is by this retropharyngeal space, this prevertebral fascia is separated from the pharynx and the buccopharyngeal fascia. Okay, then laterally it lies deep to the trapezius, attached to the fascia of the sternocleidomastoid muscle. Okay. So inferiorly, when we see this posterior layer, no, it blends with the anterior part, it blends with the buccopharyngeal fascia, whereas the posterior superior layer, it is attached to the anterior longitudinal ligament and to the. So the other features, what see, this is the fascia. This is how you can see. This is the investing layer all around here. Here we have the pretracheal fascia, and this is the prevertebral fascia. So the trunk of the brachial plexus, okay, the trunks of the brachial plexus, it lies behind the prevertebral fascia between the scalenus anterior and the scalenus medius muscle. So that is what we see in the posterior triangle, no? That is a subclavian part of the posterior triangle we see. Then the prevertebral fascia is pierced by 4 cutaneous branches of cervical plexus and the axillary sheath enclosing the axillary artery and the trunks of brachial plexus. Okay, so it also forms, because when it extends down, it forms part of the axillary sheath. This prevertebral fascia, it provides a fixed base for the movements of the pharynx, esophagus, and the carotid sheath. Okay. Next is carotid sheath. It is a very important question, carotid sheath. So carotid sheath is a condensation of the fibroareolar tissue around the main vessels of the neck. That is the common carotid artery and its branches, the internal jugular vein, as well as the vagus nerve. So formation, what happens is it is formed, it has an anterior layer and a posterior, formed by the pretracheal fascia, that is anteriorly, and posteriorly by the prevertebral fascia. So it contains artery vein nerve, AVN, okay? So that is the common carotid, which will divide into external and internal carotids. Vein is internal jugular vein and nerve is the vagus nerve. So relations here. So on the anterior wall of the carotid sheath, right, we see the formation of the, that is a loop of nerve that is known as the ansa cervicalis. Okay, so that anterior wall of the sheath. And posteriorly, there is a chain present behind the sheath. Okay, so behind the sheath, we have the chain. Dr. Sharath, I think you are not on mute. I can hear the sound. So can you please put it on mute? Thank you. So pharyngeal spaces. So pharyngeal spaces here, the retropharyngeal space. Okay. So this is important again. It is asked as a short answer question. So retropharyngeal space, okay, as the name says, it is the space behind the pharynx, okay. So it is a dead space behind the pharynx. Boundaries anteriorly there is, so if you see here, okay, so this is the pharyngeal spaces. So anteriorly there will be the buccopharyngeal fascia, posteriorly will be the prevertebral fascia, okay. Anteriorly buccopharyngeal and posteriorly prevertebral fascia is there. And okay, so here you see the retropharyngeal space. On either side, there will be the carotid sheath, and superiorly there is base of the skull, and inferiorly it is this retropharyngeal space is continuous with the superior mediastinum. Okay, so anteriorly buccopharyngeal, posteriorly prevertebral fascia. On the side there is carotid sheath, and superiorly base of the skull, and inferiorly it opens and it continues with the superior mediastinum. So what are the contents here? So basically, it has got few lymph nodes, that is retropharyngeal lymph nodes, then pharyngeal plexus of vessels and nerves, and loose areolar tissue. So here sometimes, no, what happens is, why this space is important is the pus collection due to lymph nodes, okay, which due to the infection and inflammation of the lymph nodes can sometimes lead to abscess formation, can lie in the paramedian position in this space. Okay. Then there is, other than this retropharyngeal, there is also a small space, which is a lateral pharyngeal space. So this, as the name says, it is situated on the side of the pharynx. Okay, on the side of the pharynx, lateral pharyngeal space here. So boundaries, medially, it is pharynx, posterolaterally, it is parotid gland, and okay, posterolaterally, it is parotid gland, and anterolaterally, there is medial pterygoid. Posteriorly, there is carotid sheath here. Okay, so that space is the lateral pharyngeal space. Okay, so medially pharynx, posterolaterally parotid gland, anterolaterally medial pterygoid muscle, and posteriorly there is carotid sheath. So contents here mainly will be the branches of the maxillary artery and the fibrofatty tissue. So here also Ludwig's angina can be seen. So there may be a collection of the pus because of this Ludwig's angina and all. It's basically there is infection here and the pus may be collected in the floor of the mouth. Next is sternocleidomastoid muscle. Okay, so sternocleidomastoid muscle is what? It is a large superficial muscle of the neck. Okay, very important muscle of the neck. So always when a muscle is asked, you should know its origin, insertion, action, nerve supply mainly. Okay. So this sternocleidomastoid muscle has got two heads of origin. One is sternal head, another one is the clavicular head. So sternal head, as the name says, it arises from the manubrium sterni. Clavicular head has the origin from the medial 2/3 of the clavicle. That is medial 2/3, the superior surface of the medial 2/3 of the clavicle. Insertion, both these two heads fuse, okay, they form a common muscle, and then it gets inserted into the mastoid process of the temporal bone, as well as the lateral half of the superior nuchal line. So what is this action? Okay, so what does it do? It flexes the neck. Okay, so side to side, no, when we move, flexing the neck. So this is the muscle which acts. And on the single, when they act bilaterally, it will flex. Okay, flexing the neck, flexion. Okay, single, we can flex the head and laterally rotate. Okay, so this is lateral rotation of the head to the opposite side and flexion. When both the muscles act together, it flexes, that is bending forward, head we bend forward, and single when we turn to a side. So nerve supply here. A nerve supply is by spinal accessory nerve and anterior primary rami of spinal nerves. Okay, C2 and C3. Basically, the spinal accessory is the main nerve supplying the muscle. So this muscle is enclosed. So we learned earlier that the investing layer splits to enclose this muscle, right? So it is enclosed within the investing layer of the deep cervical fascia. So what are its relations? Okay, so muscles. Muscles are near the origin. It is related to sternohyoid, sternothyroid, and omohyoid. Okay, and in the middle, it is related to scalenus. Okay, so here there will be sternohyoid, all those things, and in this middle part, it is related to scalenus medius, scalenus posterior here, So this is omohyoid. So this vertical what muscles you see will be the scalenus posterior, scalenus medius, then levator scapulis, splenius capitis. Okay. And this is the inferior belly of omohyoid. So all these muscles, it is related in the middle. And at the insertion, it is related to splenius capitis, longus capitis, as well as posterior belly. Here you can see this is the posterior belly of the digastric. Vessels, it is related to at the origin. Okay. Anterior jugular vein is there because here, no, this near the suprasternal notch, we have the anterior jugular vein. Then common carotid in the middle part, and near its insertion, it is related to occipital artery. Nerves all in the middle part here. Okay, we have the cervical plexus, the brachial plexus. Basically, all those nerves which we see it in the posterior triangle. They're all related here, as well as the inferior root of the ansa cervicalis. Glands related are in the anterior part middle here. Okay, anteriorly we will see the thyroid gland. Okay, and lymph nodes are in relation to it. Okay, so these are the relations which we can see. So what is the clinical condition here? Okay, we see torticollis. So torticollis is basically the deformity, or it is also called as wry neck. So here what happens, the head is bent to one side and chin is pointed to the other side. Okay, so because of the spasm of the muscle, the chin will be pointed towards the opposite side. Okay, and head is bent to the same side. So it is a result of basically because of the contracture of the muscle supplied by the spinal accessory nerve. Okay, so there is that is the sternocleidomastoid as well as trapezius. They are all supplied by the spinal accessory nerve. So when these muscles they go in for spasm, no, it results in torticollis, right? So torticollis can be congenital or it can be acquired. So acquired can be because of spasm, wrongful position of the neck while sleeping. Okay, so all those things can result in torticollis, that is acquired. Congenital, what happens is this muscle is shortened. Okay, the length of this sternocleidomastoid will be shortened, and because of that, it results in torticollis. Right. Next is coming to the boundaries and contents of digastric triangle. So here, this digastric triangle, where is it located? Okay, so digastric triangle forms a part of the, which one? Anterior triangle of the neck. Okay, so it is situated between the two bellies of digastric muscle. So the anterior triangle, we know further it is divided into 3.5 triangles. That is the digastric, the carotid, the muscular triangle, and the submental triangle, half of submental triangle. Submental triangle is shared on either side, right and left side. Okay. So what we are talking about is the digastric triangle now. So this is between the two bellies here. Okay. So we have to know the boundaries. So anteriorly and inferiorly, anterior-inferiorly, it is the anterior belly of digastric. Posterior-inferiorly, there is posterior belly of digastric muscle and stylohyoid. Base is formed by the base of the mandible and an imaginary line joining this angle of the mandible to the mastoid process. Okay. So that is the base. Apex is mainly formed by the tendon here. Okay, near the hyoid bone. Okay, by the tendinous insertion of the two digastric muscles, that is the posterior belly and the anterior belly of digastric. There we have the apex. Then boundaries always should be completed with floor and roof. So floor is formed by the mylohyoid. So anteriorly there is mylohyoid muscle. Then there is hyoglossus and middle constrictor posteriorly. Roof is formed by the investing layer of the deep cervical fascia, which will split to enclose the submandibular gland, which is part of the digastric triangle. So this digastric triangle is mainly divided into anterior part and a posterior part by the stylomandibular ligament. So the ligament which is attached from the styloid process to the mandible, no, it will divide this triangle, okay, into an anterior part and a posterior part. So contents in the anterior part, that is the superficial part. Okay, we have mainly the submandibular salivary gland, then submandibular group of lymph nodes. Okay, submandibular salivary gland, submandibular lymph nodes, hypoglossal nerve. Then we have the facial vein, facial artery. So facial vein will be lying superficial to the submandibular gland. Facial artery will be running deep to the submandibular gland. Okay, so that is also an common spotter question where they ask what are the vessels in relation to submandibular gland. So you need to write that. Then there is submental artery, mylohyoid nerve and vessels. Okay. In the posterior part of the triangle, there is external carotid artery, carotid sheath along with its contents. So which carotid sheath and its contents? Basically the common carotid with external internal carotid, the internal jugular vein and the vagus nerve. Okay, so this is the triangle, what we were talking about, that is the digastric. Then the submandibular triangle. Okay, submandibular triangle is basically the otherwise called as the digastric triangle. Okay, so since the submandibular gland is present, it is also called as submandibular. So this is the commonest site of swelling due to involvement of the submandibular group of lymph nodes. Because the submandibular group of lymph nodes, no, they drain most of the area of the face. Okay, so as well as the anterior 2/3 of the tongue, floor of the mouth, and paranasal sinuses, everything it drains. So since it drains, so that is why while examining, okay, the patient with a history of cold, cough, sinus problems, all those things, we examine the lymph nodes here. Okay, so to see if there is any enlargement of the lymph nodes. Okay, so these are the lymph nodes which are involved there. Okay, so with this, we finish with the class here. Okay, so thanks for watching Auricle. So for more contents, follow our social media handles on YouTube, Instagram, Facebook, and Telegram. You can also download the app on Google Play as well as App Store. Okay, until then, next time.